Hey, you! Do you feel tired all the time? Do you feel weak or dizzy? Well, we have the solution for you. All of these signs and symptoms, and many more, could mean that you're deficient in iron.
Iron?
No, not that type of iron. Iron is a nutrient that is essential to your body.
Why is this iron stuff so important?
Iron is important because it helps you to make oxygen-carrying proteins like hemoglobin and myoglobin. These proteins help to carry oxygen to your lungs and other tissues, which is essential for life. It is important but very underconsumed.
Why is iron underconsumed?
Iron may be underconsumed because of growth during childhood, pregnancy and lactation, or because there is not enough of it in the diet.
What makes me, a 22-year-old woman, have low iron?
Well, for one, women have less iron storage available in their body because they are smaller than men. And secondly, women between about 19 and 50 have iron loss roughly once a month through menstruation. When your body loses blood, like through menstruation, your iron levels go down because you are losing hemoglobin. Women are recommended to have around 17 to 19 milligrams of iron a day, and men are recommended to have 19 to 21 milligrams a day. This is a lot easier said than done because if you eat about 15 milligrams of iron, your body only absorbs about 1 milligram.
So what are the best ways for her to get iron? Can she just not take a supplement?
While supplements aren't bad, the best way to get iron is to incorporate it into your everyday diet as much as possible. The best sources of iron are meats like beef, chicken, and fish. Go.
Whoa. I'm a vegetarian. Are you saying I'm gonna have to eat meat to get iron? Iron?
No, although meats are the highest source of iron, you can get the iron you need through grains like cereal, oatmeal, bread, and pasta, legumes like beans, peas, lentils, soybeans, and peanuts, and through many vegetables like leafy greens, potatoes, and mushrooms. When increasing your iron intake, make sure to also increase your vitamin C intake because it helps with iron absorption. High sources of vitamin C include chili peppers, bell peppers, kale, broccoli, papaya, and strawberries.
So what happens if she doesn't get enough iron?
She could become anemic, which is where your body isn't getting enough oxygen circulated, which causes a variety of symptoms. She may feel very tired, dizzy, or weak. Her skin may become pale, and her nails may be brittle. She may have chest pain and shortness of breath, and she could have unusual cravings for ice or dirt.
Since there are problems if you don't get enough iron, is there problems if you have too much?
Yes, you can have too much iron in your body, and it's called hemochromatosis, which is a fancy term for iron toxicity. Hemochromatosis can cause an enlarged liver or liver damage, and you have an increased risk of getting infections. This is because bacteria thrive on iron-rich blood. You may also develop diabetes, liver cancer, heart disease, arthritis, and joint diseases if the iron toxicity is prolonged. Go.
How can we get too much iron?
Most iron toxicity comes from overdosing on iron supplements that you get over the counter. To avoid this, make sure you look at the milligrams per pill in the bottle and talk to your doctor to see how much you should take. If you do have iron toxicity, it's recommended that you eat foods that impair iron absorption, such as milk, cheese, and yogurt, and avoid vitamin C sources.
Is there anything else I should know about taking iron?
You should always tell your doctor if you're taking any supplements or over-the-counter medicines because there are many interactions that can happen. For example, taking iron while taking proton pump inhibitors or histamine H2 antagonists may decrease the absorption of iron. You may also decrease the absorption of medicines such as tetracyclines, fluoroquinolones, or levothyroxine if you take iron concurrently.
Thanks for the